there continues to be great concern about 24-hour staff community residences which are not regulated yet provide care to a large cohort of vulnerable people with long-term mental illnesses. The Mental Health Commission has stated that they take the view that they accommodate too many service users, often have poor physical infrastructure and are institutional in nature and lack individual care plans. Regulation of these residences should be prioritised, and I'm glad to hear that it may be within the coming legislation, but nonetheless it's something that should have happened before now. And as I understand it, this is the same legislation that has been promised the heads of bill every year for the last 3 years, and we still have not seen them. Over 1,300 vulnerable adults with mental illnesses were accommodated in community residences that are unregulated, mostly institutionalised settings. And we hear the mantra, Minister, about decongregation on a regular basis, but it would appear that people will be decongregated from regulated settings into unregulated settings in the community. And rather than decongregation being a situation of empowerment for people with mental illnesses, it would appear that rather they're being abandoned to these unregulated centres. We've seen in the past in terms of other centres, the Leeds Cross scandal, and I'd be very concerned that similar situations could be allowed to arise on these unregulated mental health services.
Ministers, 1 minute.
Yeah, Arish Cormagat, thank you, Deputy. Yeah, and I share the same concerns as the Deputy opposite, and I'm anxious to see the Mental Health Commission roll this out as soon as possible. Obviously, we have to get the legislative piece of work done. And regarding your comments regarding the year-on-year promise of the legislation, it will be sent to the Commission. That's a commitment I've given within the next few weeks. We're very close to finalise it, the officials in the department. I don't know how long the Commission will have, but I would be expecting that we will have the legislative journey begin on that later this year. I'm very optimistic to do so, and I'm also very anxious to do so as the Deputy opposite is, to ensure that every single centre is regulated and is visited and comes under the auspice of the Commission, not just those that exist there at the moment.
Final supplementary.
I understand, Minister, that the proposal with the legislation will be to reduce the inspection rate for actually currently regulated centres from 1 year to every 3 years. Now, we recently had a prosecution in Kilkenny, the first ever prosecution of a mental health service, I understand. We have the report out from Mental Health Reform this morning saying that patients exercising the services of the HSC are seeing a failure to treat patients with dignity, due to frequent changes of staff and a high focus on medication, and at high levels of dissatisfaction. I'm not sure that reducing the levels of inspection for current facilities is the answer to servicing the unregulated facilities. I would rather see that it should be done in addition, and the necessary resources should be put so that all services are regularly inspected.